Exercise for hypertension. Being physically active and having a good baseline physical fitness are associated with decreased risk of high blood pressure. Regular exercise has been found to reduce resting blood pressure by 7/6 of a millimeter of mercury. Reductions in BP due to exercise are more pronounced in people with high BP than those with normal blood pressure. Aerobic exercise also reduces ambulatory BP. Resistance exercises and static exercise have also been found to lower blood pressure. Aerobic exercises should be done for 5 to 7 days per week. Resistance exercise should be done 2 to 3 days per week. Flexibility exercise should be done for more than 3 days per week. Hypertensive patients should exercise more frequently than people with normal blood pressure, as even a single exercise session reduces blood pressure by 5 to 7 millimeters of mercury. This BP effect persists for around 24 hours. Patients with hypertension are recommended moderate intensity exercise. If a person can do more vigorous intensity exercise, it can done, as evidence states that more vigorous the intensity, the greater is the BP reduction. In case of moderate intensity aerobic exercise, a continuous bout of 30 to 60 minutes per day is recommended. You could also do intermittent bouts of 10 minutes each interspersed throughout the day. Recent research suggests that a continuous bout or intermittent bouts have similar blood pressure lowering effects. For aerobic exercise, perform rhythmic exercises that involves the use of large muscle groups like walking, swimming, cycling, etc. Resistance training should include resistance exercise of large muscle groups. These include bench press, shoulder press, stair climbing, through band exercises, etc. Flexibility exercises, stretch each large muscle group for 10 to 30 seconds and perform 2 to 4 repetitions for each. Before starting, one should undergo a pre-participation screening to see if they are fit to take up this exercise regime. Patients are recommended to pace exercises gradually, especially if they have been previously sedentary. Certain antihypertensive medications, diuretics and beta blockers, impair body temperature blood glucose control during exercise. Doctors should teach about the signs of hyperglycemia, the importance of hydration, and proper clothing. Sudden stopping of exercise is not recommended as it may precipitate abrupt lowering of blood pressure, which may cause syncope. Certain medications like alpha blocker and calcium channel blockers may aggravate this effect. Excess drop in BP is more common in elderly,